Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically, if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential for you to hear. Maybe it happened just once and instantly triggered a knot of worry in your gut. Or perhaps it's a recurring, silent issue you've been carrying alone, feeling a quiet shame or a deep, unsettling fear about what it might mean for your health and your sense of self. I'm Dr. Thomas, a urologist with over 12 years of clinical experience dedicated to men's vital health at every stage of life. I've sat across from hundreds of men in my office, strong, accomplished, proud men, who carried this exact concern in silence for far too long. Today I want to have a straight-talking, honest, and deeply supportive conversation with you, man to man, doctor to patient. First, and most importantly, I want you to know this. I understand your concern. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is finished. Let me be direct with you. This is not a failure. This is a message your body is sending you, and that message simply needs to be decoded. Stay with me, because in the next few minutes, we're going to break down the surprising causes, the critical warning signs you should never ignore, and most importantly, the clear, actionable solutions that modern medicine offers to restore your confidence, your peace of mind, and your overall well-being. Before we dive into what happens when the fluid is absent, let's take a quick, no-nonsense look at how this process should work normally. Think of your body's reproductive system as a perfectly timed, high-performance engine. Every component has a specific role, and the whole system depends on precise coordination. The testicles produce the sperm. The seminal vesicles contribute the bulk of the nourishing fluid. The prostate adds its own protective secretion. This final mixture is gathered and prepared in the urethra. When climax hits, specific muscles contract in a powerful rhythmic sequence to propel that fluid forward and out. It's a rapid, complex event, the result of delicate, synchronized timing between nerves, glands, and muscles that have worked together your whole life. Now here's a crucial distinction that most men, and unfortunately even some general practitioners, overlook. Climax and ejaculation are not the same thing. Let me say that again, because it matters. Climax is the neurological sensation of intense pleasure, governed by your brain and your nervous system. Ejaculation is the physical act of expelling the fluid outward. Most of your life, these two events happen seamlessly together, so you never had reason to think of them separately. But they are driven by entirely separate mechanisms in your body. Our focus today is on what's called dry ejaculation. This is the clinical term for when a man reaches climax, experiences that characteristic wave of pleasure, but notices little to no fluid is actually released. Men describe it to me in my office as an empty orgasm. The sensation is there, but the physical evidence isn't. This gap between expectation and reality is exactly what fuels the worry. You've always associated a physical release with that moment, and when it disappears, your mind goes to dark places. I completely understand that reaction, but here's what I need you to hold on to. Your ability to feel pleasure remains intact, governed by your nerves and brain. The change is in the mechanical delivery system. That's it. This does not mean you've lost your virility. It means a specific, identifiable part of your body's plumbing has shifted, and we need to find out why. Quick pause here. If you're finding this information valuable, and I believe you are, because you've stuck with me this far, go ahead and hit that like button. It tells the platform that this kind of serious, honest men's health content deserves to be seen. Subscribe so you don't miss our next conversation. And drop a comment below. Tell me where in the world you're watching from. I love seeing this community of men from different countries, different backgrounds, all showing up for their health. That takes real strength. Now, let's get into it. Here are the 3 most common causes of dry ejaculation. As a man, I believe you deserve to understand the mechanics, not just be handed a diagnosis. Knowing the why is the first step to feeling back in control. Cause number 1. The gatekeeper is too relaxed. Retrograde ejaculation, the single most common cause of dry ejaculation, is a condition called retrograde ejaculation. Let me walk you through the biology so it makes sense. Picture a small but powerful muscular valve. Think of it as a gatekeeper, positioned at the exit of your bladder. During climax, this valve is supposed to clamp down firmly, ensuring the seminal fluid has only one direction to travel, forward and out. That's the normal route. But if this valve is too relaxed or compromised, the fluid follows the path of least resistance and flows backward into the bladder instead of exiting the body. You experience the full pleasure of climax, but because the fluid never exits, the experience feels completely dry. Here's a practical clue you can look out for at home. If you notice that your urine is notably cloudier than usual right after intimacy, that's often a non-alarming indicator that the seminal fluid has entered the bladder and is now mixing with your urine. What causes this valve to relax? Two main culprits. First, certain surgeries on the prostate or bladder. These procedures are often medically necessary and performed correctly, but they can affect the delicate network of nerves that controls this muscular gate. The surgery works, but as a side effect, the valve mechanism is altered. Second, specific medications used to treat conditions like high blood pressure or benign prostatic hyperplasia, or BC, which is an enlarged prostate. These medications are designed to relax blood vessels or muscle tissue in the prostate, but that same relaxing effect can reach that little valve, causing it to stay open when it should be closed. I remember a patient of mine, a retired engineer, tough as nails, a man who had faced every challenge in life head-on. After a successful and necessary prostate surgery, he came into my office absolutely shaken. He thought something had gone deeply wrong. When I sat with him and explained that it was purely a mechanical alteration, like a traffic light that got stuck in the open position, not a sign of dysfunction or illness, and that his desire, his ability to feel pleasure, and his erectile function were all completely intact, the relief on his face was something I won't forget. Knowledge is power, gentlemen, always. Cause number 2. The plumbing is blocked. Ductal obstruction, the second major cause of dry ejaculation, is a physical obstruction in the ducts through which seminal fluid must travel. Here's how to think about it mechanically. The seminal vesicles and the other glands responsible for producing the fluid are doing their job fine. Production is normal. But the small ducts that act as delivery pipes are blocked. If the pipes are obstructed, the fluid simply cannot pass through, regardless of how much is being produced. Volume drops dramatically or disappears entirely, even though the glands themselves are working correctly. What causes these blockages? The most common source is scarring left behind by past infections. A severe or poorly treated episode of prostatitis, inflammation of the prostate, can leave scar tissue in its wake that partially or fully blocks these delicate ducts. Less commonly, small calcifications, essentially microscopic stones, can form inside the ducts and obstruct normal flow. The symptoms of a ductal obstruction can be subtle enough that many men miss them entirely. Some men describe a new, mild discomfort in the pelvic area during or after climax. Others recall that the volume of fluid has been gradually decreasing over a long period, becoming progressively thicker and less abundant, before finally approaching zero. Here's the good news, and I mean real, clinically solid good news. Many of these obstructions are treatable. Depending on the cause, anti-inflammatory medications may be enough to resolve the issue. For more persistent or significant blockages, minimally invasive procedures can often restore normal flow and function. This is not necessarily a permanent situation. A proper evaluation gives you options, and options mean control. Cause number 3, the fuel is low. Hormonal factors, the third major area to investigate, and one that's often underdiagnosed because men tend to dismiss the symptoms as just getting older, is the hormonal dimension. Specifically, I'm talking about low testosterone. Testosterone is not just about desire and muscle mass. It is the primary fuel that drives the entire male reproductive system. It regulates sperm production, yes, but critically, it also governs the optimal functioning of the prostate and the seminal vesicles, the glands responsible for producing the bulk of the seminal fluid. When testosterone levels drop significantly below the normal range, the entire system begins to underperform. Everything slows down. Initially, you might notice a gradual reduction in fluid volume. But over time, as the deficiency deepens, the effects ripple out. Decreased libido, less firm erections, a noticeably less intense sensation during climax, and beyond the bedroom, fatigue that doesn't go away with rest, unexplained shifts in mood, and gradual loss of muscle mass. Many men I see have been living with these symptoms for years, chalking them all up to age. Age is not a diagnosis, gentlemen. Age is not an excuse to feel less than your best. The clinical term for this condition is hypogonadism, a treatable hormonal deficiency. A single blood test can confirm whether your testosterone levels are below optimal range. If they are, carefully managed hormone replacement therapy, tailored specifically to your body and your health profile, can often restore not just improved fluid production, but also your energy, your drive, your mood, and your overall quality of life. I'll say it plainly, it is a mistake to write off hormonal decline as inevitable. Yes, testosterone naturally decreases with age, but the degree and the impact vary enormously between men, and when the deficiency is clinically significant. Treatment can make a profound difference. You deserve to feel vital. Don't let anyone, including yourself, convince you otherwise. Now, as much as I want to reassure you, part of my job, a critical part, is to tell you the truth about when dry ejaculation warrants urgent medical attention. Because while the causes we've discussed are manageable in the vast majority of cases, there are important exceptions that must not be ignored. When to see a doctor immediately if dry ejaculation appears suddenly and without any obvious explanation, and especially if it is accompanied by any of the following, you must not wait. Seek urological evaluation right away. Watch for pain during or after climax. Blood in the urine or in what little fluid is produced. Fever, a sudden or progressive loss of sensation in the genital or pelvic area. Any combination of these symptoms alongside a sudden change in ejaculation signals something that must be investigated without delay. Conditions such as Parkinson's disease, uncontrolled long-standing diabetes with associated nerve damage, and in rare but real cases, specific urological cancers can interfere with either the nerve pathways that control ejaculation or the physical structures involved in the process. These conditions are serious. Early identification leads to better outcomes. Period. I'm not telling you this to frighten you. I'm telling you this because I respect you enough to give you the complete picture. The vast majority of men who come to see me with this concern have a manageable, treatable cause, but the minority who have something more serious are always better off having found out sooner rather than later. Knowledge is not the enemy. Ignorance is. The emotional weight, and why it matters, we need to address something that doesn't show up on any blood test or imaging report. But that I see in my office constantly. The emotional impact of dry ejaculation is real, significant, and far too often dismissed, even by the men suffering through it. Many men, particularly men of our generation, have built a strong internal association between physical performance and their sense of self-worth and masculinity. When the physical signs of that performance change, it can feel like something fundamental about who you are has been taken away. Feelings of inadequacy, anxiety, and deep frustration can take root quickly. And because men tend to suffer in silence, these feelings compound over time. I've seen men quietly begin to withdraw from intimacy with their partners, not because they've lost desire, but because they fear judgment. They fear being seen as less than whole. They avoid the conversation because they don't have the words, or because they believe that bringing it up will make it more real. Here's what I want you to know. Man to man, your intimate life does not hinge on the presence of seminal fluid. Your capacity to feel pleasure, to be present, to connect, to give and receive intimacy, none of that is measured in milliliters. These are governed by your nervous system, your emotional availability, and the quality of your relationships. A physiological change in your body's mechanics does not define your worth as a man or a partner. The most powerful step you can take is the one that feels hardest. Talk about it. Talk to your doctor. Talk to your partner if you feel safe doing so. Naming the thing takes away much of its power over you. And understanding that this is a physiological shift, not a personal failure, not a character flaw, not a sign of weakness, lifts a weight that many men have been quietly carrying for far too long. Your action plan, taking back control, I want to leave you with something concrete and actionable. Not vague advice, but a real roadmap. Step 1. Don't ignore it. Investigate it. Whether this is a one-time occurrence or a pattern you've noticed developing over time, a visit to a urologist is the right move. We will take a full clinical history, perform a focused physical examination, and order the appropriate blood and urine tests. In most cases, That's all it takes to arrive at a clear, confident diagnosis. No fear, no mystery, just answers. Step 2. Manage your underlying conditions with discipline. Chronic conditions, diabetes, hypertension, elevated cholesterol are among the most common underlying contributors to both vascular and nerve problems that affect ejaculatory function. If you've been told you have these conditions and you haven't been managing them consistently, this is your reminder that the consequences extend further than you may realize. Control them. Your urological health depends on it. Step 3. Break the silence. Talk to your partner. Talk to your doctor. Both conversations matter. Your partner deserves to understand what's happening so they can support you rather than interpret your withdrawal as something it isn't. And your doctor, your urologist specifically, is there precisely for this. We don't judge. We solve problems. That's the job. Step 4. Stay ahead of your health. Preventive urological checkups are not just for men with symptoms. Catching shifts in hormonal levels, prostate health, or ejaculatory function early means more options and better outcomes. If you're over 50 and you haven't had a urological evaluation in the last 2 years, that's your homework. Closing. The truth about vitality, gentlemen. Let me close with this, because it matters. The absence of seminal fluid during climax is not the end of your intimate life. It is not a verdict of lost masculinity. It is not your body giving up on you. It is a signal, specific, investigable, and in the vast majority of cases, addressable. I've sat across from countless men who came into my office believing the best years of their intimate lives were behind them. Men who carried shame and silence for months, sometimes years. And I've had the privilege of watching those same men walk out with a diagnosis, a plan, and most importantly, a new sense of control over their own health. Your vitality is not measured in milliliters of fluid. It is measured in your health, your awareness, your willingness to face what's happening in your body with courage and curiosity rather than fear and avoidance. The men who act, who pick up the phone, schedule the appointment, and show up are the ones who get answers, and answers lead to solutions. I'm Dr. Thomas, and my commitment is to give you the information you need to make empowered, informed decisions about your health at every stage of life. Don't let doubt, pride, or shame stop you from seeking the answers you deserve. Acting in time can change everything.